In the 16th century, when medicine was the domain of scholars and charlatans, and surgery the grim craft of executioners, one man defied centuries of dogma. He was a barber, a simple craftsman with no academic degree or noble lineage. Yet he dared to do what no one before him had. He abandoned the barbaric practice of cauterizing wounds with red-hot irons, replacing it with the ligature of blood vessels. He sparked a revolution. He became the father of modern surgery. His methods saved thousands of lives, fundamentally altering the essence of healing. His story is not a tale of sudden enlightenment, nor a myth of a genius to whom truth was revealed in a dream. It is a testament to how perseverance, keen observation, and the courage to challenge the system can change the world. Great discoveries rarely occur in the quiet of a study. They are born in the dust of battlefields, in the desperation faced with death, in the constant search for a better solution. Such was the case for Ambroise Paré. In those centuries, when human life was cheap and disease considered divine punishment, medicine remained shackled by dogmas, written a millennium and a half earlier. The ancient Greek texts of Galen and Hippocrates, thoughtlessly copied and distorted, dictated every action of the healer. Anatomy was a closely guarded secret, and dissections were rare exceptions, often forbidden by the Church. Scholars and universities debated treatises but seldom descended to observing the sick. Surgery, separated from high medicine, remained in the hands of barber-surgeons and bath attendants, whose methods were as cruel as they were primitive. The battlefield, a terrifying ordeal for the body, was a realm of pain and hopelessness. Gunshot wounds, a novelty of the 16th century, were believed to be poisoned. The logic of the time demanded expelling the venom. The most common and authoritative method was to pour boiling oil into the wound. The searing liquid hissed, burning away flesh, transforming living tissue into a dead, charred mass. The screams of the wounded drowned out the roar of battle. Those who survived such procedures were more a miracle than a result of treatment. But even those who escaped boiling oil faced another deadly dogma. Any wound suppuration, redness, swelling, and purulent discharge were not seen as signs of disaster, but as laudable pus, evidence that the body was expelling the disease. Doctors and surgeons waited for the wound to fill with a yellowish-green mass, believing it to be a natural, even desirable, stage of healing. They did not suspect that each day of such waiting brought the patient closer to sepsis, gangrene, amputation, or death. In a world where ignorance was the norm and suffering an inevitability, every step forward required not only genius, but also incredible courage to challenge millennia-old misconceptions. Into this world, steeped in fear and ignorance, came Ambroise Paré. He was born in the small town of Bourg-Hersent, the son of a humble carpenter. He had neither noble lineage nor a university diploma, making him an outsider in the world of learned physicians. His path to the profession lay through craftsmanship. He became a barber-surgeon, learning not from ancient Galenic folios, but from experienced practitioners whose hands were stained with blood, not ink. Young Ambroise spent 3 long years at the Hôtel-Dieu, a Parisian hospital. This place was less a healing institution and more an antechamber of death, where the most destitute and condemned were brought. Thousands of patients passed through its wards, each a living testament to the helplessness of medicine at the time. There, in the dirty, overcrowded wards, Paré daily witnessed the consequences of centuries-old dogmas. He saw wounds, considered poisoned, doused with boiling oil, turning living flesh into charred remains. He observed limbs blackening and dying after such procedures, while fevers claimed hundreds of lives, leaving only empty beds. He saw doctors at times simply awaiting death, citing past authorities, pages written a millennium and a half earlier. Physicians, robed in academic gowns, argued over the subtleties of Latin and Greek, while a patient died in the next ward. They did not deign to touch a wound or assess a pulse. Their world was one of theories and dogmas. Ambroise's world was different. It was a world of suffering, screams, and inevitable ends. He was a practitioner, not a theoretician. His textbook was not an ancient manuscript, but the flesh and blood of living people. These sights could not leave him indifferent. He saw patients dying not from disease but from treatment. He saw prescriptions, considered inviolable, leading only to new torments. A deep, unspoken doubt began to germinate within him. A doubt that the millennia-old methods, sanctified by time and authority, were the only correct ones. This was not academic curiosity but a burning, agonizing dissatisfaction, born directly at the bedside. This doubt, forged in the crucible of human suffering, became the first, barely perceptible, step toward revolution. The doubt born within the hospital walls was soon tested in the furnace of war. In 1537, young Paré embarked on his first military campaign, becoming a field surgeon for the French army. It was a world where death was ubiquitous and suffering commonplace. The Battle of Villanueva de la Barca became his first true test. Cannonballs and arquebus bullets tore through flesh, leaving terrible wounds. Traditionally, these wounds were to be cauterized with boiling elderberry oil. But by the end of the day, with hundreds of wounded filling the field hospital, the oil ran out. There was none left. Horror seized Paré. What to do? Leave men to die? Or take a risk? Despair became the mother of invention. Paré, recalling folk medicine knowledge and his observations, prepared a simple balm: egg yolk, rose oil, and turpentine. This was not science in the understanding of university doctors, but merely an attempt to alleviate pain. He applied this balm to the wounds of those who lacked oil and dressed them with clean bandages. The rest, by old custom, were treated with the remaining boiling fat. The night was long. Paré did not sleep, expecting the worst. He was sure that those who did not receive the correct treatment would die from poisoning or infection. Morning brought a stunning discovery. The wounded whose wounds had been doused with boiling oil groaned in unbearable pain. Their flesh was charred, inflamed, some already beginning to blacken. Pus and fever were everywhere. This was the scene he had witnessed hundreds of times. But those Paré had treated with his balm slept peacefully. Their wounds were clean, without signs of inflammation. The skin around them was soft, untouched. They did not cry out in pain. They were surviving. This was not just a discovery. It was a blow to centuries of dogma. Boiling oil did not heal. It killed. A soft balm saved lives. This became a moment of truth. Paré understood that his eyes, his observations, his experience, were more important than thousands of years of dogmatic ignorance. He abandoned wound cauterization once and for all. From that day on, he used only clean dressings and soothing balms. But Paré did not stop there. If wounds could be treated more gently, what about amputations? Before him, the only way to stop bleeding after a limb was severed was to cauterize it with a red-hot iron or plunge the stump into boiling oil. This method was as ancient as it was cruel. The pain was unbearable, the shock often fatal. Many patients died directly on the operating table, not from the injury, but from the treatment. In 1545, during the siege of Metz, Paré again defied tradition. Instead of cauterizing vessels, he applied a method long known but almost forgotten: the ligature of arteries. He took a thin but strong thread, specially prepared for this purpose, and carefully tied off each bleeding artery, one by one. It was a painstaking procedure, requiring incredible precision. The result was astonishing. Bleeding stopped without terrible burns. Patients suffered far less. The mortality rate after amputations plummeted. This was not a miracle. It was logic applied to anatomy. Paré proved that lives could be saved without inflicting unbearable torment. He didn't just change one method. He changed the very paradigm of surgery, demonstrating that compassion and observation were more important than blind adherence to outdated rules. His journey had only just begun, but the foundation of modern medicine had been laid. However, the laid foundation required walls to be built. Paré was not a scholar who studied the causes of diseases from treatises. He was a practitioner whose laboratory was the battlefield and whose textbook was the human body. His greatest instruments were not a scalpel or forceps, but eyes capable of seeing and a mind ready to doubt. He didn't just observe. He compared. He analyzed. He learned. When he applied his balm to wounds, he expected failure. But when the morning revealed that his incorrect treatment saved lives, while the correct one, boiling oil, maimed and killed, Paré did not turn away. He accepted this fact, however unthinkable it seemed. This was empiricism in its purest form, experience over dogma. He was not afraid to admit he had been wrong, expecting the worst from his experiment. Moreover, he actively sought such errors of the past to find seeds of truth within them. He constantly refined his methods, honing them in the crucible of real practice. It was this approach, this unwavering faith in the power of observation, that became the cornerstone of his revolution. He didn't just abandon cauterization. He developed and perfected the technique of ligating arteries, which required not only an understanding of anatomy, but also new instruments. Old tools, adapted for barbaric methods, were unsuitable. Paré, a man of action, didn't wait for someone else to invent what was needed. He took up drawings himself, and sometimes even metal, creating forceps for grasping vessels, retractors for holding tissues, and needles for ligation. Each new instrument was an embodiment of his new, more humane philosophy of surgery. These were not just devices. They were tangible proof that surgery could be performed differently. But Paré understood that his discoveries would remain merely personal experience if the world didn't know about them. In an era when medical knowledge was the preserve of the elite, locked away in Latin folios, he took a bold step. He began to publish his works. And not in Latin, the language of academics and theologians, but in simple French, the language of the people, the language of those very barber-surgeons who, like him, daily faced death on battlefields and in dirty hospitals. His books, written in clear, accessible language, came as a genuine shock to the medical establishment. They were a call to change, a guide to action, not just philosophical reflections. He shared not only his successes, but also the details of his techniques, demonstrating exactly how to ligate vessels, how to apply dressings, how to care for the wounded. This was not just the dissemination of knowledge. It was the creation of a new, accessible paradigm. Paré did not seek fame in academic circles. He sought to save lives. He did not hide his methods behind the veil of learned Latin. He revealed them to all who were willing to learn. He was not just a surgeon. He was a teacher, a reformer, an engineer, changing the very essence of healing, step by step, refining every method, every instrument, every word, so that his knowledge would not remain the preserve of one person, but become the common heritage of all humanity. However, the dissemination of his ideas was not smooth. The academic world, which had lived in an ivory tower for decades, could not accept such a blow to its foundations. A simple barber, without a diploma, without knowledge of Latin, dared not only to practice differently, but also to teach others. He was not a doctor of medicine in their understanding. He lacked the university education confirmed by centuries of tradition. He was merely an artisan whose hands were stained with blood, not the ink of ancient folios. His works directly contradicted Galen and Hippocrates, the pillars upon which all their knowledge rested. How could an unlettered practitioner challenge wisdom consecrated by millennia? His methods, born in the dust of battles and hospital wards, did not fit their scholastic framework. They were not derived from philosophical treatises. They were the result of observations, of empirical experience, which for the learned men was almost an expletive. The indignation grew. To write about medicine in French? This was unheard of. Latin was the sacred language of science, a barrier separating the elite from the common people. Paré broke down this barrier, making knowledge accessible to anyone who could read. This undermined their authority, depriving them of their monopoly on knowledge. They called him a charlatan, an ignoramus, a dangerous innovator. They accused him of heresy against medical dogmas. They claimed his methods brought death, not healing, despite obvious results. Doctors from the University of Paris, especially those who defended the purity of ancient doctrines, saw him as a direct threat. They tried to ban his books, to strip him of his right to practice in the capital. They filed complaints, organized public disputes where his ideas were ridiculed, and his origins were presented as proof of his incompetence. Their world, built on the authority of the past, on quoting Galen, on complex Latin terminology, crumbled under the blows of his simple but effective solutions. They could not or would not see that their patients were dying from correct treatment. But Paré had powerful protection, his patients, and not just commoners, but those with real power, the kings of France. Henry II, Francis II, Charles IX, Henry III. All of them entrusted their lives and the lives of their families to him. For monarchs, scholarly disputes, Latin quotations, or university degrees held no sway. What mattered was the result. Paré saved their soldiers on the battlefield, their generals, their courtiers. He treated them personally for the most severe wounds and illnesses. While court physicians, clad in robes and surrounded by volumes of Galen, merely threw up their hands, Paré acted, and he saved lives. Royal favor was his shield. It protected him from attacks, granting him the freedom to work and publish. He became the personal surgeon to 4 kings, a status that was undeniable. In a world where the monarch's power was absolute, His approval outweighed any academic prohibitions and accusations. The kings did not merely tolerate his methods, they demanded them, seeing their effectiveness with their own eyes. They saw those considered doomed return to life. They saw less suffering, more recoveries. This was not merely a confrontation between two schools of thought. It was a battle between authority and results, between dogma and observation, between the past and the future. And in this battle, on Ambroise Paré's side stood not only truth but also the might of the crown, whose interests aligned with saving human lives. It was this combination, Paré's genius and royal protection, that allowed his revolution to not be suppressed, but to pave the way for all modern surgery. And yet, even royal favor could not entirely silence the whispers of envy and open indignation. The academic world did not give up. To them, Paré remained an upstart, a threat, an insult to their centuries-old traditions. They demanded proof, unwilling to acknowledge the obvious. Then, in 1554, under pressure from the Paris Faculty of Medicine, Ambroise Paré was summoned for an official examination. It was the last, desperate move by his opponents, an attempt to definitively strip him of his legitimacy. He, already the renowned surgeon to 4 kings, was asked to undergo a test designed for young apprentices. It was a humiliation. It was a challenge. But Paré accepted it. He knew that not only his name but the fate of all new surgery was at stake. He entered the hall where distinguished doctors awaited him, clad in robes, with volumes of ancient authorities tucked under their arms. They asked questions in Latin, trying to confuse him, to catch him on his ignorance of scholastic intricacies. But Paré answered. He spoke of the wounds he had seen, of the bones he had set, of the lives he had saved. He spoke in simple, clear French, which was his strength, not his weakness. He described anatomy not from ancient texts, but as he had seen it with his own eyes, dissecting bodies. He explained treatment methods that were not drawn from Galen, but born in the crucible of practice. He demonstrated profound knowledge based on thousands of cases, not on philosophical speculations. He answered every question, refuting dogmas with facts and theories with living experience. His composure, his confidence, his undeniable competence astonished the examiners. They sought an ignoramus, but found a master. Paré did not just pass the exam, he passed it brilliantly. His knowledge was deeper, his understanding sharper than many who had spent years in university classrooms. This was not just a recognition of his mastery. It was a public, undeniable triumph of empirical knowledge over age-old dogma. It was the moment when a simple barber-surgeon definitively secured his place in history. His opponents were forced to retreat. They could no longer dispute his right to practice, his right to teach. He became more than just a surgeon. He became a master, a teacher whose name became synonymous with salvation. Soon he would assume the post of provost of the College of St. Cosmas, becoming the head of all Parisian surgeons, a symbol of a new era in medicine. His triumph in the examination was not merely a personal victory. It was a turning point for all of medicine. With his elevation to provost of the College of St. Cosmas, Paré's methods began to permeate the very foundation of surgical practice. The barbaric cauterization of wounds with hot irons or boiling oil, which had for centuries been considered the only correct way to stop bleeding and expel venom, gradually became a thing of the past. Now, thanks to Paré, surgeons across France and beyond were mastering the technique of ligating arteries. Instead of charred flesh and unbearable pain, patients felt only the tight constriction of a thread. This not only reduced suffering but also drastically lowered the risk of fatal shock and subsequent infection. While survival rates after amputations were once negligible, their implementation with ligation significantly increased, and though precise figures from that time are hard to establish, the trend was clear. Hundreds of lives condemned to death by treatment now had a chance. The approach to wound care also changed. The concept of laudable pus, the false belief that purulent discharge was beneficial, began to be challenged. Paré showed that clean, regularly changed dressings and simple, soothing ointments promoted healing, not putrefaction. He taught his students not to wait for a wound to fill with a foul-smelling mass, but to actively maintain cleanliness, which, without an understanding of germ theory, intuitively brought surgery closer to aseptic principles. The incidence of severe infections and gangrene significantly decreased. The publication of his works in French was of colossal importance. Knowledge previously locked away in Latin treatises became accessible to thousands of barber-surgeons and practitioners. This led to the standardization of methods and the spread of advanced techniques beyond royal hospitals. Anyone who could read could now learn from the great master. This was true enlightenment in practical medicine, a democratization of knowledge that allowed a new generation of surgeons to work more effectively and humanely. Under his leadership, the College of St. Cosmas began to reform training. Practical experience, observation, and anatomy became central elements of surgical preparation, displacing scholastic disputes and blind citation of ancient authorities. Surgery began to separate from craft and approach the status of a science. Paré did not merely change individual methods, he changed the very philosophy of healing, forcing the medical world to look at the human body not through the prism of millennia-old dogmas, but through the prism of direct observation and empirical experience. His legacy is not only the lives saved, but also the transformation of the entire attitude toward pain, suffering, and the possibility of healing. Thus, a simple barber-surgeon, devoid of university regalia and Latin treatises, became the father of modern surgery. He did not theorize but acted. He did not quote the ancients but observed the living. His story is not only a narrative of the triumph of humanism over cruelty, but also an eternal reminder. True breakthroughs are not born in cozy offices, but on the front lines of human suffering, when the courage to challenge old truths meets an unwavering faith in the power of direct experience. This is how one man, by rejecting centuries of misconceptions, changed the very